Hello everyone, my name is Rose and I'm going to be doing a newborn assessment. Before I do that, I wash my hands, I put my gloves on, and I make sure that the baby remains partially covered throughout the whole assessment. First, we will start with one set of vitals. Usually we do the heart rate, the respiration, and the axillary temperature. And we don't usually do blood pressure unless it is clinically indicated. So first, I will uncover the chest of the baby. I will listen for the heart rate and the respiration for 1 full minute. After 1 full minute, I will record it. Then I will take the temperature. Make sure the thermometer is at room temperature so the baby doesn't become uncomfortable throughout the assessment. So after I'm done with the axillary temperature, I will record it. And normal heart rate would be vary from 120 to 160, the respiration 30 to 60, and the temperature would be 97 to 99.5. Now that I'm done with the set of vitals, I will look at the baby general condition. Is the baby alert? Is the baby moving around? Is the baby's looking at me? I put my hands in front of the baby to see if the baby is looking at the hand, following the hand. Then I would move the head. I would look for any symmetrical, feel, palpate the head. I want to know if it's smooth, bulging points, except the fontanelle. Interior fontanelle and the posterior fontanelle is supposed to be soft also. And then I would look at the eyes. When I look at the eyes and I'm looking for any drainage, anything abnormal, any redness, look at the nose for assess familia, the little black white spot on the nose. Then I will assess the lips. They're supposed to be pink, moist, and non-cracking. Then the ear is supposed to be aligned with the outer canthus of the eye. And I would put with my clean gloves, so I would put my small finger inside the baby's mouth to check for sucking reflexes. Baby gonna suck on my finger. Then when I'm done doing that, I would also check the baby cheek to see if baby is turning the head toward that finger with the mouth open, which is telling me baby has good reflex, good wounding reflex. Then when I'm done with all of that, with the head, we will move to the neck. Check for any lump. Usually baby's neck are usually very short. And after I check the neck, I would assess the clavicle, and then I would assess for moral reflex. I would pick up the baby, and the baby's head is supposed to come upward with the rest of the body. Then I'll put baby back. I'll check for the brachial pulses. I will check to see range of motion. If baby have a good muscle tone, I would assess the symmetry of the arm, look at the fingers, if all the fingers are there, and all of that. Now that I'm done with the arms, I'm gonna move to the chest area. Now to the chest, I'm gonna assess for any symmetry, and then I would assess the skin, overall skin, to assess for jaundice, any type of jaundice. When I'm looking at the chest, I look at the chest rise to see any irregularity, which is common for babies. Then I would auscultate for lung sounds. It's the same landmark as for adults. Now that I'm done with the chest, I can cover this side of the baby. And then we're gonna move to the abdomen. Now, to move to the abdomen, what I'm gonna assess for the abdomen, I'm gonna look for any distension, which is abnormal, and then I will palpate for tenderness. How to assess for tenderness? Every time I touch one side of the baby's belly, I would look at the baby to see how the baby's reacting, if it's guarding, if it's being uncomfortable. So after I do that, I would assess the umbilical area for any signs of infection, any drainage, any redness. Then when I'm done doing that, I would cover the baby and remove the diaper partially, and then goes down. So when I'm done with that, I would expose the genitalia. So the genital area for the little boys, I would look for if the testes are descending into the scrotum, if there's no discharge, if it's symmetrical, or no redness or anything. If it's for a female, I would assess for mucousy discharge with a tingy blood, which is normal for a baby girl. And then I would cover the baby and then put the diaper back. And then we'll move to the legs. To the legs, we're gonna assess for symmetry. The knees are supposed to be aligned, the feet are supposed to be aligned. Then I would check for the hip assessment. What I would do, I would at the same time hold both babies' feet and then move it in a circular motion, both of them in a circular motion. And if I hear a click, I would assess for the hip assessment to see if the click is being heard. And then when I'm done with that, this is called the Bartolini, or the Bartolini maneuver. And then when I'm done with that, I would look at the sole of the babies to see if there's any wrinkles, and which is normal. Now you get the wrinkles. And then I would also assess for the Babinski reflex. Babinski reflex is when you, with one finger, you stroke from the heel upward to the baby's sole. And the fingers are supposed to hyperextend it outside. And it's telling me that the baby's having good Babinski reflex. So when I'm done doing that, I'm done. I will move the baby on the belly and I will assess the back. I will look at the spine to see if it's straight, if there's no lump, if there's no discoloration. And usually at the bottom, the discoloration are going to be a bluish color, usually called Mongolian spot. It's normal at this stage. And then look at the baby anus to see if there's any redness, any meconium, which is the baby's bowel movement. Then look at the baby both back of the knee to see if they're symmetrical. And when I'm done with that, I'll move the baby back to the back. Make sure the baby stays warm. If the baby needs to be changed, change a diaper. And then cover the baby. And this is it for the newborn assessment. Thank you for watching.